Effects of COVID 19 that persist for more than 4 weeks after you've been diagnosed with COVID 19 virus. This is called post COVID syndrome. So, let's see what are the main symptoms that are associated with post COVID syndrome. Starting with fatigue, shortness of breath, cough, joint pain, chest pain, memory, concentration, and sleep problems, muscle pain, headache, faster bounding heartbeat, loss of smell or taste, depression or anxiety, fever, dizziness when you stand, worsened symptoms after physical or mental activities. Although COVID 19 is seen as a disease that primarily affects the lungs, it can damage many other organs as well. This organ damage may increase the risk of long-term health problems. Image tests taken months after recovery from COVID 19 have shown lasting damage to the heart muscles, even in people who experienced only mild COVID 19 symptoms. This may increase the risk of heart failure or other heart complications in the future. The type of pneumonia often associated with COVID 19 can cause long standing damage to the tiny air sac known as alveoli in the lungs. The resulting scar tissue can lead to long term breathing problems. Even in young people, COVID 19 causes stroke, seizures, and Guillain-Barré syndrome, a condition that causes temporary paralysis. COVID 19 may also increase the risk of developing Parkinson's disease and Alzheimer's disease. Some adults and children experiences multi-system inflammatory syndrome after they had COVID 19. In this condition, some organs and tissues become severely inflamed. Blood clots and blood vessel problems. COVID 19 can make blood cells more likely to clump up and form clots, while larger clots can cause heart attacks and strokes. Much of the heart damage caused by COVID 19 is believed to stem from very small clots that block the tiny blood vessels. Other parts of the body affected by blood clots including lungs, liver, and kidneys. COVID 19 can also weaken blood vessels and cause them to leak, which contributes to potentially long lasting problems within the liver and the kidneys. Psychological effects of COVID 19. People who have severe symptoms of COVID 19 often have to be treated in a hospital's intensive care unit with mechanical assistance such as ventilators to breathe. Simply surviving this experience can make a person more likely to later develop post traumatic stress syndrome, depression, and anxiety. Because it's difficult to predict long-term outcome of the new COVID-19 virus, scientists are looking at long-term effects seen in related viruses, such as the virus that caused severe acute respiratory syndrome, known as SARS. Many people who have recovered from SARS has gone on to develop chronic fatigue syndrome, a complex disorder characterized by extreme fatigue that worsens with physical or mental activity but doesn't improve with rest. The same may be true for people who had COVID 19. Many long term effects of COVID 19 are still unknown. It's important to remember that most people who have COVID 19 recover quickly, but the potential long lasting problem from COVID 19 make it even more important to reduce the spread of COVID 19. Precautions include wearing a mask, social distancing, avoiding crowds, getting a vaccine, and keeping hands clean.